everybody. Welcome to this live performance on Facebook.
Jeg tror ikke, det er nu her. Oh, wait. Så, nu.
Okay. Hi, everyone. Welcome to this live performance about feet on Facebook. This is Paulina. My name is Per. I'm a Danish physiotherapist working a lot with feet injuries and especially treating children with Sever's disease. Yeah.
Yes, and we are from Soulmates, a Danish company. And we are hosting our first Facebook Live today. And the reason for this is that it's National Feet Week in the UK, and we want to celebrate that by asking you, Per, a lot of questions. So
Yes.
let's get started.
Okay.
Yes. So first of all, a person has asked, how do I choose the right shoes?
Yeah. It depends on your activity. So the shoe market is huge. There are thousands of shoes to choose among. So, but general, it's important that you feel comfortable in your shoes.
Yes.
So that's rule number one.
Yeah.
And of course, you like your shoes as well. You don't want to buy ugly shoes
No,
that fit
that's
you.
true.
So of course, but if you are walking a lot of steps during the day, it's important that you have space enough inside the shoes.
Yeah.
It's important that you have a good support to your shoes, and you have cushion support in your shoes as well. If you are going hiking in the mountains, you have to wear hiking boots. If you're going for a run, you have to wear running shoes, good running shoes. So it depends on the activity.
Yeah.
And if you're going to a party and want to wear high heels, it's okay as well.
Yeah.
It's only for a couple of hours.
Okay, cool. So you don't think there's any bad shoes? Or is there?
There is.
There is.
There
Okay.
is bad shoes. So it depends on how many hours you spend in your shoes. If you spend many hours with your shoes, they have to be very good shoes.
Yeah.
So most of the fashion shoes are very bad shoes.
Okay.
Too light, too soft, too thin, with no support at all. Yeah.
Okay. So bad shoes do exist. Yes. And
There are- most of the shoes are bad shoes. If you take the insoles out of your shoes and stand on these insoles, you can see that your toes are going way beyond the limit of the insole. Yeah.
Okay. So how important do you think the insoles are in a shoe?
The insoles that are built in normal shoes are original insoles, but if you have a feet problem, you have to get customized insoles and replace them with the original insoles.
Yeah.
Yeah.
Great, Per. Thank you. So another person has asked, how do I get Sever's disease?
Sever's disease is only for kids between the age 6 and 14.
Yeah.
It is a growth plate injury.
Yeah.
Actually, it's not an injury; it's a pain condition in the bone. So, if you are a very sport active child, you have a greater risk of developing Sever's disease. Especially sport with a lot of jumping and running, such as football, tennis, gymnastics, and track on hard surfaces.
Yeah.
But Sever's disease is something that is there for a period. It can be a very long period, and it can be quite painful. And but when the growth plate closes, Sever's disease is gone, and so is the pain.
Okay. So if someone is listening that do not maybe understand all the anatomy of the foot, what can you explain a bit more? What is a growth plate?
I can show you actually.
Yes. Perfect.
I have a picture here of a foot. Maybe you can see it here. This is a normal foot where we have the growth plate here on the back part of the heel. It is closed on this adult feet. When it comes to the child, it looks quite different. I just had to see if it can get the reflections away. Yes, here we have the growth plate. It looks like a fracture. And this is an area where there's a lot of hormonal change due to the when the growth curve increases. And this area is more soft and more weak for a period.
Okay.
And the impact on the heel when the child is running, if there is not enough rest, the inflammation starts, and so does the pain.
Okay. Yeah.
And there are a lot of children with Sever's disease, and some will be only a little affected by the pain. Others will need to take a break from sport or stop their sport entirely due to Sever's disease.
Okay. And how do you think this affects the children?
Of course, when it's for a long period, it affects them a lot.
Yeah.
Because they can't perform the sport they love, and they can't be with their friends, and it's also very important for the motoric development of the child to stay active.
Yeah.
So if I've seen many children with Sever's disease for 2, 3, even 4 years, and that's far too long with this pain.
Yeah.
Yeah.
So maybe some children are wondering, if you have Sever's disease, will there be any permanent damage to the foot afterwards, or the feet afterwards?
We have not seen so far a single child that will not get rid of Sever's disease. So when the growth plate closes, the pain is gone.
Okay, that's good to know.
Yeah.
That's good for the children. Okay, yes. Another question is, how do I know if I have Sever's disease, and what should I do if it is the case?
Yeah. For the first, if you are a child between 6 and 14 with heel pain, it can't really be anything else if it's heel pain. There are very few diagnoses, heel diagnoses, that it can be when you're a child.
Okay.
But of course we have to test it.
Yes.
But there are 2 tests that can show you if it's Sever's disease. The one is what we call a heel walk test. You take your shoes off and walk only on your heels barefooted. And if the pain, if you can feel the pain, it's a sign of Sever's disease. Okay. The second test is a squeeze test, where I'll show you on this plastic foot, where you put pressure on the side of the heel bone like this. And this test is always positive when it's Sever's disease.
Okay.
So it's very simple to do this, to test for Sever's.
Okay.
You don't have to take any X-ray or MR scan or anything like that.
Okay.
Yeah.
So is this something you can do at home, or should you see a professional? Or
Yes, you can actually do the test at home.
Okay.
But if you are not sure, I definitely recommend that you go to a professional.
Yes.
Yeah.
And then if it is positive, if this heel squeeze is positive, then what do you do?
Yes, we have. There are not. No treatment really helps on Sever's disease. So you can't, with electrotherapy or exercises, make the pain go away.
No.
So this is why we developed this special insole to make the heel rest while the child is active.
Yeah.
And this is we have very good results by this way, because it's possible to reduce the impact against the heel bone.
Yeah.
But like Sever's disease, we actually allow a little degree of pain in the heel. So because we know it goes away.
Yeah. Okay.
In the end.
Okay.
Yeah.
So it's all right for the child to have a little bit of pain sometimes, but
sometimes. But if the pain increases, it's important to react.
Okay.
And lower the activity level, and we recommend that you get these insoles to help. the
Yeah.
child. Yeah.
Yeah. So when do you think that the pain is so severe that you should see help? Or, when in the...
If it has been going on for more than 3 or 4 weeks,
Yeah.
this is a sign that it would not go away in the future.
Yeah.
And if your child starts to feel the pain when the child is active,
Yeah.
starts to participate more passive
Okay.
during activity,
Yeah.
play and sport activities. This is a good point. This is a good period to treat the child with the
Yeah.
insoles.
Okay. Yeah. So if the child can no longer participate fully, they should see a practitioner.
Yes.
Yeah.
Yeah.
Okay. That's good to know. Yes. And then there is a question here. Do I need special footwear to use the Soulmates insoles, or do they fit in all my shoes?
The Soulmate supplier customize the insoles so they can be used in sport shoes and in daily shoes as well.
Okay.
So of course, if there are a big difference in size,
Yeah.
if you have winter boots that are very big, and then you have soccer boots that's or football boots that are quite smaller, it's difficult to customize the insoles so they fit in both.
Yes.
But it's the most important thing is that the insole fits the shoes where the child has the problem, and
Okay.
that's in the most cases sport activities or during
Okay.
play.
Yes.
Yeah.
So yeah, the football boots and yeah, active shoes.
Yes.
They're the most important.
Tennis shoes,
Tennis shoes, yeah.
running shoes, and so on.
Yeah.
Yeah.
Okay. And do you know, now that we talk about the sports, if there are any sports that are where more children have Sever's disease?
Yeah, football. We see, of course, it's also the biggest sport in our countries in Europe.
Yeah.
So it seems like football, especially boys playing football, especially boys at the age 9 and 10, have a greater risk of developing Sever's disease.
Yes.
Especially boys training and play matches on AstroTurf. These very hard plastic courts are very hard to the heels. But we also see gymnastics, and that's another issue about the gymnastics, because they don't wear
No, they don't wear any shoes.
any shoes,
No.
but we recommend they wear special shoes to wear the insole so they can use them in warming up and during the exercise where they don't have to spin around 1,000 times.
Yeah. Okay.
Yeah.
Okay. Yeah. So for a gymnastic who does it barefooted,
Yeah.
she or he can also use the insoles.
Yes.
Yeah.
Yeah.
Okay, that's good to know. Another question here is, let's see what we got. Yes, there's one asking, I'm 58 years old and have pain in the same spot. Do you think an adult can have this problem?
As I mentioned before, when the child turns 15 or 16, Sever's is gone, so you'll never get Sever's anymore. So
okay.
An adult 58 years old can't have Sever's, but it can be other heel diagnoses like heel pad syndrome or a bone bruise in the heel bone, or it can be plantar fasciitis, or it can be a Achilles problem, or you can have instability in your heel that causes the pain.
Okay.
So you have to be tested by a specialist.
Yeah.
And it's typical when you have turned 40. The heel pain starts for the adults.
Okay.
Yeah. We see a lot of adults with heel pain as well.
Do you know? Do you know why, or?
Because the heel pad is more flat when you are You can see it here. This yellow part is a heel pillow. It's getting more flat during the years,
Okay.
and there is more. It's not supported that much.
No.
So we have to remember that our feet they change during life.
Yes.
So when you get older, the feet, like the rest of the body, starts to degenerate,
Yeah.
and maybe the arches of the feet will get lower, and that can cause many other feet problems as well.
Okay.
And this is where other kind of insoles comes in.
Okay. Yes.
Yes.
And what kind of insoles could that be?
Again, customized insole,
Yeah.
because the feet are very different, so they have to be customized individually
Yes.
and there are different materials in different treating different diagnoses. So if you have a flat forefoot,
Yeah.
we have to build up something called a pilot
Okay.
to raise the forefoot. If you have instability problem with overpronation, we have to build arch support.
Okay.
And this arch support it's very important that you still have this possibility to move downwards in the pronation. So this is a very long story.
No.
So but it's very there are a lot of good materials.
Yeah.
But there are also a lot of more prefabric insoles on the market that in my experience not is the best but it can be a short solution for a problem.
Okay.
But if you really want to have insoles with high quality, you have to make them customized made by a specialist.
But that makes sense, yeah. That
Yeah.
all our feet are individuals, and
Yes.
therefore they should be custom made. Yeah.
Yeah.
Makes sense. Now you mentioned something about a flat forefoot. So someone has also asked, I have flat feet, and what can I do about that? Is it a problem to have flat feet?
Probably no. If you have flat feet, you have flat feet.
Yes.
And your body is used to these flat feet. So I know that there are many people living a long life with flat feet that don't cause more problems than normal foot types with a normal arch.
Okay.
Of course, in some cases there can be problems.
Okay.
With an instability or cushioning problems in the feet.
Okay.
And then you have to be aware of wearing the right shoes with the right support.
Okay.
And flat feet also is a little bit wider, or a lot more wider, so you have to have space enough in the shoes.
Okay. That's good to know.
Yeah.
Are there any exercises you can do to strengthen your feet if you have flat feet?
I would like to say yes,
Yeah.
but you can't train your foot back to normal position.
Okay.
You can train the muscles when you have flat feet. It's always a good idea to train the muscles underneath. But if you think you can train your foot arches up again, you can't.
Okay.
But exercises again, if you it's a whole chapter for itself. If you have Achilles problems and if you have plantar fasciitis, there are different exercises.
Okay.
So, and if you have heel problems or toe problems, there are exercises for them as well.
Okay.
So you have to remember that the foot is a region in our body that takes a lot of space in the brain. So like our hands, but we forget to use our feet because we have very good shoes, and the muscles in the feet is kind of, sleeping. So we have to wake them up again by training.
Okay, so
And a good thing is to walk barefooted in the summer on grass to train the feet, and
yes.
and then you can do exercises especially for the feet alone.
Okay.
Yeah.
Yeah, so everyone could actually do some more exercises.
That
their
would be
feet.
good.
Yeah.
But we also know that these exercises, for many people, they're very boring. So they do them for a couple of days and then they stop doing them. So
Okay.
yeah.
Yeah. Maybe we should start doing it more, all of us.
I definitely recommend.
Yeah, that's good to know.
Yeah.
So if you, I think I read somewhere that most babies, or maybe all babies, are born with flat feet. That children often have flat feet.
No, that's not.
That's not true. No.
But they have a lot of fat under their feet when they are newborn.
Yeah.
And this fat makes the foot look flat.
Yes. Okay.
But if you take an X-ray, you actually can see the arch of the foot.
Okay, interesting.
But that journey from when you're born to when you to raise to walk and run on your feet, it's a long journey for a child. So it starts by grabbing things. You can see a newborn child start very quick to use the feet to grab.
Yeah.
Use it like a hand.
Okay. Yeah,
so,
that's interesting.
Yeah, and this is the first step to develop the muscles under the feet.
Okay. Okay, interesting.
Yeah.
But so when do you know if you have flat feet? And at what age do you see?
You can see around the age of 9 and 10 which foot type you probably will get as an adult.
Okay.
So if you stand on we have a special box with a mirror where you can walk on your bathroom floor when you have wet feet.
Okay.
You can see if there is an arch or if it's just totally flat.
Okay.
But many people, they are just surprised that they have this kind of foot type. Maybe they ignore their feet, but it's a little bit surprise for me that many adults don't actually know what foot type they have. Yeah.
Yeah. I mean, I've never thought about my foot type before. Yeah. So but that's not, I guess it's only if your feet start to hurt that you will wonder about.
Because that's the region in the body that have the highest load. Yeah. So the feet are very important for your life because they have to wear you along all your life. Yeah. In different environments. So you have to take care of your feet.
Yeah. Well, that's a really good point. I think that leads us to the last question to you, Per. So, being a foot specialist, can you give 3 reasons for why we should appreciate our feet some more?
Yes, as I just told, they have to carry you through the life. So you have to take care of your feet. Yeah. That's the first point. The second point is that you have to take care of your feet because you can get many diagnoses in the feet if you don't take care of them. Okay. And when you're a child, you have to develop your feet. You have to be aware of, good shoes with enough space, because in that period when the toes are growing, they have to be formed with space enough. Yeah. So if you have too narrow, too slim shoes, the toes will be formed after the shoes, and that can cause many problems as an adult. Yeah. It's very important to take care of your feet. Yeah. Yeah.
Thank you so much, Per. This has been great.
You're welcome.
Yes, and thank you, everyone. Bye.
Bye-bye.